Did you know your arteries can stiffen in seconds, and that simple stretches can help relax them just as quickly? For seniors living with hypertension, stiff arteries mean higher blood pressure, greater strain on the heart, and more risk of complications. But here's the encouraging truth. You don't always need medication to get quick relief. Gentle, doctor-approved stretches can improve circulation, open blood vessels, and instantly calm the stress that drives hypertension. In this video, we'll share 5 powerful stretches that instantly relax your arteries. Each one is easy, safe for seniors, and can be done right at home without equipment. Along the way, you'll also discover how these stretches help not just your blood pressure, but also your muscles, joints, and energy levels. Disclaimer: this video is for educational purposes only. It is not medical advice. Always consult your healthcare provider before starting or changing any exercise routine. Why stretching helps arteries and blood pressure. Stretching is more than flexibility, it's medicine for your arteries. When most people think about stretching, they imagine loosening tight muscles or improving flexibility. But here's the hidden truth. Stretching can also directly benefit your arteries and blood pressure. For seniors with hypertension, this makes stretching not just a bonus, but an essential part of daily health. How stiff arteries affect blood pressure. Your arteries are like flexible tubes that carry blood from your heart to the rest of your body. When they're flexible, they expand and contract easily, keeping blood pressure steady. But with age, stress, and hypertension, arteries can stiffen. This makes it harder for blood to flow smoothly, forcing the heart to pump harder and raising your blood pressure. Stretching helps counteract this stiffness. By gently lengthening muscles and improving circulation, it encourages your arteries to relax, making it easier for blood to flow without resistance. The science made simple. When you stretch, blood vessels widen, improving circulation. Nitric oxide, a natural chemical that relaxes arteries, is released. Stress hormones like cortisol drop, reducing pressure on the cardiovascular system. The parasympathetic nervous system, the rest and relax system, becomes more active, calming your heart rate and blood pressure. In other words, stretching doesn't just help your body feel loose, it actively creates a safer environment for your heart. Why seniors benefit the most? Improved circulation. Stretching helps blood move more efficiently through legs and arms, reducing pooling and swelling. Less morning stiffness. Many seniors experience higher blood pressure and tighter arteries in the morning. Stretching eases both. Stress reduction. Gentle stretching paired with breathing lowers anxiety, a hidden trigger of hypertension. Accessibility. Stretches can be done sitting or standing, making them safe for all fitness levels. Beyond blood pressure benefits. Stretching also protects your joints, improves balance, and reduces the risk of falls, all of which contribute to long-term independence. Seniors who stretch regularly often report better sleep, reduced aches, and higher energy. Stretching is not just about loosening muscles. For seniors with hypertension, it's a simple, natural way to relax arteries, lower blood pressure, and protect heart health every single day. Stretch number 1, seated forward bend. A simple forward bend can take tension off your heart. If there's one stretch that almost anyone can do safely at home, it's the seated forward bend. This gentle movement doesn't just ease stiff muscles, it also encourages blood to flow more freely, helping your arteries relax and lowering the pressure on your heart. For seniors with hypertension, it's one of the simplest yet most effective ways to begin calming the cardiovascular system. Why this stretch works? When you bend forward slowly, your body naturally relaxes. This position helps lengthen the back muscles, release tension in the neck and shoulders, and gently massage your abdominal area. More importantly, it reduces stress signals in the nervous system, which means less pressure on your arteries. Combined with deep breathing, the seated forward bend becomes a mini reset button for your circulation. What's happening inside the body? Artery relaxation. Gentle forward folding encourages blood vessels to widen, lowering vascular resistance. Improved circulation. Blood moves more freely toward the head and upper body. Stress reduction. Forward bends activate the parasympathetic nervous system, calming the heart. Muscle release. Stretches tight hamstrings and lower back muscles, improving posture and reducing strain on the spine. How to do the seated forward bend, safe for seniors. Sit tall in a sturdy chair with feet flat on the floor. Inhale deeply, lengthening your spine. As you exhale, hinge gently forward from the hips, not the waist, letting your arms rest on your thighs, shins, or toward the floor. Keep your neck relaxed and shoulders loose. Hold for 15 to 30 seconds while breathing slowly. Slowly return to upright on an inhale. Variation. If bending deeply feels uncomfortable, simply lean forward slightly and rest your hands on your thighs. Even a small angle creates benefits. Extra benefits beyond blood pressure. Reduces stiffness in the spine and hips, making daily movement easier. Calms anxiety, making it a great stretch before or after stressful situations. Improves digestion by gently compressing the abdominal area. Can be practiced almost anywhere, in the living room, at the kitchen table, or even before bed. Safety tips. Move slowly and avoid jerking forward. Don't hold your breath, keep breathing steady. If you feel dizzy or lightheaded, return to upright immediately. Seniors with severe osteoporosis or back injuries should keep the bend shallow and consult a doctor before trying. The seated forward bend is one of the simplest stretches to relax arteries, reduce blood pressure, and calm both body and mind, making it a perfect first step in your daily routine. Stretch number 2, standing side stretch. This stretch opens your chest and lets your arteries breathe. The standing side stretch is a gentle movement that creates space in the chest, ribs, and lungs while lengthening the muscles along your sides. For seniors with hypertension, this is more than just a flexibility exercise. It's a way to improve oxygen flow, ease pressure on arteries, and promote healthier circulation. Why this stretch works? When you reach overhead and bend to the side, you open up the chest cavity and expand the rib cage. This allows the lungs to take in more air, fueling the body with oxygen and reducing tension in the cardiovascular system. At the same time, the gentle bend stretches tight muscles in the torso, relieving stress that can keep blood pressure elevated. What's happening inside the body? Chest expansion creates more room for the lungs, supporting deeper breathing and oxygen delivery. Artery relaxation. As the torso opens, the blood vessels around the chest and heart experience less compression. Improves circulation. Encourages blood flow along the spine and upper body. Stress reduction. Gentle stretching signals the nervous system to relax, lowering stress hormones like cortisol. How to do the standing side stretch, safe for seniors. Stand with feet shoulder width apart, knees slightly soft. Inhale and slowly raise both arms overhead, palms facing each other. As you exhale, gently lean to the right side, keeping your body long, avoid collapsing forward. Hold for 10 to 20 seconds while breathing slowly and deeply. Inhale back to the center, then exhale and repeat on the left side. Perform 2 to 3 times per side. Variation. If reaching overhead is difficult, place one hand on your hip and stretch the other arm overhead, or simply keep both hands on the hips and bend gently. Extra benefits beyond blood pressure. Relieves stiffness in the spine and ribs, improving posture. Enhances lung capacity by training deeper breaths. Loosens tight shoulders and upper back muscles, reducing tension headaches. Builds gentle balance as the body learns to stabilize while bending. Safety tips. Avoid leaning too far. Focus on length, not depth. Don't hold your breath. Keep inhaling and exhaling smoothly. Use a wall or sturdy chair for support if balance feels unsteady. Seniors with severe balance issues should perform a seated side stretch instead, staying stable while enjoying similar benefits. The standing side stretch is a simple, energizing way to open your chest, improve circulation, and instantly relax arteries, making it a perfect addition to a morning routine for seniors with hypertension. Stretch number 3, cat-cow stretch. Gentle spine movement can instantly calm your nervous system. The cat-cow stretch is a classic movement often taught in yoga, but it's also one of the safest and most effective stretches for seniors with hypertension. It combines gentle spinal movement with deep breathing, helping to release stiffness, relax arteries, and calm the nervous system. The best part? It can be done either seated or standing, making it accessible for almost everyone. Why this stretch works? Hypertension is often fueled by two major factors: stiff arteries and stress. The cat-cow stretch addresses both. By moving the spine rhythmically, blood flow improves throughout the back and torso. At the same time, coordinated breathing activates the parasympathetic nervous system, the body's natural rest and relax response, which lowers stress hormones and helps bring blood pressure down. What's happening inside the body? Spinal mobility. Gentle flexion and extension improve circulation along the spinal column. Chest opening. The cow phase expands the chest, improving lung capacity and oxygen flow. Artery relaxation. Coordinated breathing increases nitric oxide, a natural chemical that widens blood vessels. Stress release. Slow, controlled movement signals the brain to reduce cortisol and adrenaline. How to do the cat-cow stretch. Seated version for seniors. Sit tall in a sturdy chair with feet flat on the floor, hands resting on your knees. Inhale as you arch your back slightly, lifting your chest and looking upward, cow pose. Exhale as you round your back, pulling your belly inward and tucking your chin, cat pose. Continue flowing slowly between the two positions for 5 to 8 breaths. Standing variation. Place hands on your thighs, bend knees slightly, and perform the same motions while standing for more mobility. Extra benefits beyond blood pressure. Reduces stiffness in the spine and improves posture. Relieves tension in shoulders and back, common in seniors. Enhances digestion by gently massaging abdominal organs. Promotes relaxation, making it useful before sleep as well as in the morning. Safety tips. Move slowly, never force the range of motion. Keep breathing steady, don't hold your breath. If you feel dizzy or uncomfortable, pause and return to a neutral seated position. Seniors with severe osteoporosis should keep the motion small and gentle. The cat-cow stretch is more than a spine exercise. It's a powerful stress reliever that improves circulation, relaxes arteries, and helps lower blood pressure naturally. Stretch number 4, calf stretch. Relax your legs, relax your arteries. Your calves may not seem connected to your heart health, but they play a surprisingly important role in blood pressure control. Known as the second heart, the calf muscles help pump blood back up from the legs toward the heart. When these muscles are tight or weak, circulation suffers, pressure builds in the arteries, and hypertension becomes harder to control. That's why the calf stretch is a must-do for seniors with high blood pressure. Why this stretch works? When you stretch your calves, you improve blood flow in the lower body, where pooling often occurs in seniors. By reducing stiffness, you make it easier for blood to move upward, easing the load on the heart. This helps prevent blood pressure spikes, swelling in the ankles, and even reduces the risk of dangerous clots. What's happening inside the body? Improves circulation. Stretching calves activates the muscle pump that supports blood return to the heart. Artery relaxation. Less tension in the lower legs means smoother blood flow and lower resistance. Reduced pooling. Prevents blood from stagnating in the legs, lowering risk of dizziness when standing. Joint support loosens ankles and Achilles tendons, improving mobility and balance. How to do the calf stretch, safe for seniors. Stand facing a wall or sturdy chair for support. Place your hands on the wall, step your right foot back, and press the heel gently into the floor. Keep the back leg straight, front knee slightly bent. Lean forward slowly until you feel a gentle stretch in your back calf. Hold for 15 to 20 seconds while breathing steadily. Switch legs and repeat 2 to 3 times per side. Seated variation. Sit in a sturdy chair, extend one leg forward with heel on the ground, and gently pull toes back toward you using a towel or strap. Extra benefits beyond blood pressure. Relieves leg cramps, common in seniors. Reduces stiffness from sitting or sleeping. Improves walking ability and endurance. Supports balance, reducing the risk of falls. Safety tips. Never bounce. Keep movements slow and controlled. Hold on to a wall, chair, or railing for balance. If you feel pain, not just a stretch, ease out immediately. Seniors with circulation problems or neuropathy should keep stretches gentle and check with their doctor. The calf stretch may look simple, but it's one of the most powerful ways to improve circulation, support heart health, and instantly relax your arteries. Stretch number 5, chest opener with deep breathing. Open your chest, expand your lungs, and lower your blood pressure. One of the simplest yet most powerful ways to relax your arteries is to combine chest opening stretches with deep breathing. For seniors with hypertension, this movement is a game changer. It not only improves posture and lung capacity, but also directly calms the nervous system, a natural way to reduce stress-driven spikes in blood pressure. Why this stretch works? Poor posture, especially rounded shoulders and a collapsed chest, restricts breathing and increases tension on the heart. A chest opener reverses this, creating space for the lungs to expand. When paired with slow, deep breathing, it boosts oxygen delivery, relaxes the arteries, and signals the brain to switch from fight or flight into rest and relax. The result? Lower stress, smoother blood flow, and healthier numbers. What's happening inside the body? Expanded lung capacity. More oxygen enters the bloodstream, easing heart workload. Artery relaxation. Deep breathing increases nitric oxide, widening blood vessels. Stress relief. Activates the parasympathetic system, calming the heart rate. Posture correction reduces upper body stiffness, preventing strain on the chest and arteries. How to do the chest opener with deep breathing, safe for seniors. Sit or stand tall with feet hip-width apart. Clasp your hands behind your back, or hold a towel if mobility is limited. Inhale deeply as you gently pull your shoulders back and down, opening the chest. Lift your chin slightly and expand through the rib cage. Exhale slowly through pursed lips, releasing tension but keeping chest open. Repeat 5 to 7 slow breaths. Seated variation. Place hands on the sides of a chair, gently press shoulders back, and focus on deep breathing. Extra benefits beyond blood pressure. Relieves neck and shoulder tension, common in seniors. Improves balance by strengthening postural muscles. Boosts confidence. Standing tall creates a sense of energy and openness. Enhances sleep by promoting relaxed breathing patterns. Safety tips. Avoid overextending your shoulders. Keep movement gentle. If clasping hands is uncomfortable, use a towel or strap. Move slowly. Never force the chest open. Stop if you feel dizzy or short of breath. The chest opener with deep breathing is a simple but powerful stretch that reduces tension, improves posture, and instantly relaxes arteries, making it a perfect finisher for any daily routine. Putting it all together, 10-minute stretching routine. Here's how to combine all 5 stretches into one powerful routine. You've learned the 5 individual stretches that instantly relax your arteries. Now let's put them together into a simple 10-minute morning or evening routine that you can follow daily. The best part? You don't need equipment, you don't need a gym, just a chair, a few minutes, and consistency. The flow: seated forward bend, 2 minutes. Sit tall, inhale deeply, and hinge forward gently from your hips. Rest hands on thighs or shins. Take slow, deep breaths, letting your back and arteries relax. Standing side stretch, 2 minutes. Stand tall, raise your arms overhead, and gently lean to one side. Hold for 20 seconds per side, repeat twice. Focus on expanding the ribs and breathing deeply. Cat-cow stretch, 2 minutes. Sit in a sturdy chair or stand with hands on thighs. Inhale as you arch the back, cow. Exhale as you round it, cat. Flow slowly with the breath for 6 to 8 cycles. Calf stretch, 2 minutes. Stand with one leg back, heel pressed to the floor. Hold 20 seconds per side, repeat twice. Breathe deeply, relaxing the legs. Chest opener with deep breathing, 2 minutes. Clasp hands behind your back or hold a towel. Inhale as you pull shoulders back. Exhale through pursed lips. Repeat 5 to 7 deep breaths, keeping posture tall. Why this routine works? Smooth circulation. Every stretch encourages blood flow, reducing arterial stiffness. Stress reduction. Deep breathing activates the rest and relax system. Balanced effect. The stretches cover upper body, spine, and legs for total body artery health. Consistency friendly. Only 10 minutes, making it easy to repeat daily. Extra benefits beyond blood pressure. Eases morning stiffness, making daily tasks easier. Improves posture and balance. reducing fall risk. Enhances flexibility, lowering joint pain and muscle cramps. Boosts mental clarity by pairing movement with oxygen-rich breathing. This 10-minute stretching flow is a natural, doctor-approved way to relax arteries, lower blood pressure, and energize your body. Practice daily, it works like a gentle medicine that supports heart health and independence. Conclusion. The truth is simple. You don't always need heavy workouts or complicated routines to protect your heart. Sometimes just a few minutes of mindful stretching can make the biggest difference. These 5 doctor-approved stretches, the seated forward bend, standing side stretch, cat-cow, calf stretch, and chest opener, work together to relax your arteries, improve circulation, and keep blood pressure under control. And here's the best part. They're gentle, safe, and designed for seniors. With only 10 minutes a day, you can ease stiffness, calm stress, and give your heart the support it deserves. Over time, these small daily actions add up to stronger arteries, better energy, and greater confidence in your health. Disclaimer. This video is for educational purposes only. It is not medical advice. Always check with your healthcare provider before beginning or changing any exercise routine. If this helped you, give it a thumbs up, share it with someone who needs it, and hit subscribe for more doctor-approved ways to protect your heart and lower blood pressure naturally. Thank you for watching.